Pfizer is warning doctors that it expects to run out of penicillin for children by the end of June. The most notable one is probably amoxicillin.
No, it's bacillin.
Oh,
Bacillin
I'm
is the
glad
one
that I'm glad that you
Right.
corrected it. Well, this one is a common antibiotic that we use to treat a variety of childhood infections, including ear infections and strep throat and pneumonia, and that's what we have Dr. Greg Silverman here to tell us, what you need to know about why it's happening, how long it will go on, and what you can do to treat your child safely. So why is there a shortage, first of all?
Who knows? I mean, this is
Are
one of those
more
supply.
kids getting sick?
No, that's not that more kids are getting sick. This is one of those supply chain issues. I'm sure of. They wouldn't say it in the article exactly what happened, but they're starting to run out of a medicine called penicillin, which is a long-acting injectable penicillin. And generally, what happens is kids just get one shot, and that's it. It stops. That's why penicillin works. That's why penicillin is good. There are other workarounds for this for your physician, for your doctor to say, well, maybe we can give them amoxicillin, which is an oral medicine, but takes a little bit longer. You may need to treat somebody for 5 to 7 days. So this is one of those, rather than just give one shot and you're done, you may need to go on to a longer treatment options for this.
So let's talk about those treatment options. I know for a lot of smaller children, for parents, it gets tricky to give these medicines to the kids.
Right, it is a little bit harder. That is, you may have to have some oral medicines, and it depends on your kid whether or not they like to take medicines. I know my kid, just thinking about Father's Day, my kid would not take medicines, so you have to kind of trick around them. There's a lot of different, I've been watching these videos where people are tricking them by putting them in juice boxes or putting them behind juice boxes, or fooling your kid into saying, yeah, this is what you're supposed to be drinking rather than what the medicine is. And so it's sometimes you're going to just have to use those kind of rules. Use your parenting skills a little bit to get them to take the proper medicine.
And speaking of parenting skills, a lot of parents are asking, why can't they just use adult medication? No, right?
You cannot. The amounts are different, and you have to, in all children, you have to correlate it to the size and the weight and the age of the kid. So talk to your physician, talk to whoever it is that you get your medical care from for your kid if they get sick, especially if these biologics, especially if they have a strep throat or some sort of fevers, or your doctor says, yeah, we're going to need to treat. It's really more of a decision for your physician to say, we don't need to use this, we can use this, but here's what you're going to have to do.
Always go to your physician. If you have a question, that's what
Right.
they are there for.
Right,
That's
this is
we
what we
have
do. We are experts in this. We've had
That's
some
your
training
job.
with this. It's time that you talk to your physician.
That's right. Thank you so much for being
Have a great
with
week.
us. And
Yeah.
happy belated Father's Day.
Well, thank you very much.
Now, if you would like for Dr. Silverman to answer one of your questions, all you have to do is text it to the number on your screen. That is 361-855-6397.